Welcome, dear viewers, to our format today, Natural Medicine. Today we are talking to our guest, Dr. Med Heinz Lüscher, about the topic of high blood pressure. What natural possibilities there are to lower it, you will find out in a moment. Stay tuned. Hello, dear Heinz, nice to have you back.
Hello, Corina.
Nice that you are color coordinated for blood pressure today. We didn't even know, but nice. The topic of high blood pressure. I mean, there are already 16-year-olds who have high blood pressure. That definitely seems to be a concern.
Yes, blood pressure is a popular disease. You can really say that. People over 50 who have normal blood pressure are in the minority.
Which, of course, is always tempting when the patient comes to the doctor. That he says, yes, that's normal. That's just the way it is.
The doctor doesn't say that.
Yes, that would be nice. I've heard that more often.
So what? High blood pressure?
Yes, yes.
Yes, that's true. That's true. It's true, of course, that blood pressure increases a little over the course of life. That's true. Because the vessels become a little less elastic, a little more rigid. And that increases blood pressure by nature. But not to 180.
Yes, and then you always like to take a blood pressure reducer.
Yes. Look, 30, 40, almost 40 years ago I was a GP. There was a rule. Blood pressure 100 plus age would be normal. The highest, the systolic value. So up to 60, not up to 90. So up to 160 in age we tolerated at the time. And now there are just new studies. There is a big New York study, about 5, 6 years old. The result is that we have to go down to 120 in all patients.
Wonder who has paid for this study.
Yes, but I see in practice that many colleagues do this. So even people my age are pushed down to 120. And I see that as unnecessary, maybe even wrong. Because, as I said, normally the blood pressure increases in the course of life. Our vessels not only become stiffer, but there is also a certain arterial calcification. This is normal. And if now in the brain individual vessels are somewhat narrowed by some deposits, then I need a higher pressure that my brain is bleeding enough. If I now go down to 120 or even lower with a 70-year-old, it may be that a deficiency in blood pressure in the brain is triggered. And I really want to avoid that.
And what happens then?
Yes, that makes people dizzy and they don't feel well anymore. They may faint. If someone tells me about dizziness, then I always ask for blood pressure lowering drugs. And I notice it myself. 6 years ago I had a blood pressure crisis. I still don't know why. It was around 200 to 110. And I had to take medication. There are such extremely high blood pressures that react to nothing but medication. But of course I tried to get rid of it quickly. And I succeeded. But there are phases where something happens. I don't know what was going on. But if my blood pressure now drops below 120, then I feel dizzy. I sometimes have that when hiking. Suddenly for 10 minutes I almost have to sit down. And then I know I could have measured it by chance. Then I was at 105 or so. Yes, blood pressure is dynamic. You just have to know that. And when I measure it at home, it's 140 again. These are very different values, also depending on the time. I learned that at night when we are relaxed, the blood pressure is at its lowest. But for me, when I measure it, it is at its highest when I wake up in the morning. But I can't explain it. Because it was different for me when I learned it. I observed it more and more with patients. People who say, yes, I measure it at home, I'm always at 150. Then I say, come to the practice and we'll measure at 9 or 10 o'clock. Then they are at 120. I have no idea why that is high in the morning. But you can't take that as a value for the whole day.
Yes.
The ideal blood pressure is certainly at 120 to 80. I agree with that. But with older people, I'm more generous. At my age, at 70, I leave a blood pressure of 150 to 90 without treatment. But I'm an exception.
Of course, you can also rely a little on your experience as a doctor. I look at a patient, how does he get in? Is he circulation well? Does he have a good face? Or does he look completely dehydrated and has blue cheeks from all the bursted vessels?
Absolutely. Most people who only have high blood pressure are healthy. They work, it's all normal life. They just have to take pills because of the blood pressure. Yes. And look, there are of course few diseases that cause high blood pressure. Serious ones. They are rare. A kidney artery stenosis, which causes high blood pressure, over 200. These are rare diseases. I've practically never seen that before. Most people, over 90% of all patients with high blood pressure have essential hypertonia. That means you don't know why.
Yes, if someone comes to you and says, okay, I got a blood pressure reducer prescribed by my doctor, but I don't want to take it anymore. What options do I have? How do I get regulated?
Well, you have to be careful. I never say, let's leave them and take something natural. That's not possible. I have to lower the blood pressure medication under control, but only if the natural remedies work in the meantime. You can't just blindly go without blood pressure medication. That's important. I always have to explain this to my patients. Many of my patients want to be treated naturally. But I have to say, look, if you go to 170 without the medication, then you have to take it. There are several substances in nature that lower blood pressure, but only very mild ones. I have this hammer of omega product, which brings the blood pressure from 180 to 120. Of course, there is no such thing. We have to be honest. I can list them. We need omega-3, we need vitamin D, we need magnesium, we need arginine, an amino acid, and possibly cayenne pepper. The last two expand blood vessels, and everything that expands blood vessels lowers the pressure. In severe cases, I need all these micronutrients.
Yes, I knew L-arginine. Especially when it comes to potency problems, you can also use it to expand blood vessels. I used to have a seminar on this. Diabetes, type 2, all these blood pressure issues. L-arginine also has an effect without side effects. It is also a good combination.
It expands the blood vessels everywhere. Then you have such nice side effects. Nature also has side effects, but they are always positive.
Especially with omega-3, it also has a blood pressure lowering effect. I think there was a study where blood pressure reducer and omega-3 in high doses were compared.
There are many studies on omega-3 and cardiology. This is Professor von Schacke. I don't know if you have heard of him. He is a cardiologist, a professor of cardiology. He is perhaps the world's best specialist for fats. He has studied these omega-3 acids really well. I rely on his results. We know that the heart pump force, in the case of heart insufficiency, can be improved up to 10% with omega-3 fatty acids. Where omega-3 affects blood pressure lowering, I'm not quite sure. What I know is that with high doses of omega-3, certain deposits in the blood vessels can be dissolved again, which is not possible in school medicine. And if the vessels are better permeable again, then the pressure also drops. This is probably the working mechanism.
I also think that's a nice side effect, which you can really see and measure, that the HDL simply rises. And that's why I also have a great effect with cholesterol, due to omega-3.
Yes, HDL rises.
Yes, I always see that. For once gave you a hint.
Did I learn something from you?
Yes, funny. School medicine also claims that it is difficult to influence.
Now that you mention it, I have to say that's true. My HDL. No, I don't know exactly where the HDL is.
Yes, and that's also the main thing.
Yes, that may be. HDL is the good cholesterol supporter, although it's not that clear. Yes, exciting.
Yes, that's definitely possible. The issue with overall cholesterol, that it is no longer considered differentiated. You know, it's also going in the direction of the cholesterol reducer.
Yes, well, that doesn't really have much to do with blood pressure. Cholesterol is not a danger to me. Cholesterol is a building block in the brain. We need high doses of cholesterol for our brain to function normally. And cholesterol is also the building block of most hormones. So if I lower cholesterol, then I have a hormone problem. And in the long run, a brain problem. I think that's already been shown in documentaries.
Yes, even in the mainstream.
So that's clear. But in the further education, we are being pushed. You have to lower. LDL, the dangerous one, should be lowered to 1.4. Mine is at about 5.
Yes, if the ratio is correct, then again with HDL.
No, that doesn't fit for me either. But that doesn't interest me at all. Because this cholesterol reduction is a so-called surrogate marker. For me it is crucial what kind of life expectancy I have and how healthy I stay. And there is practically no difference whether you take a cholesterol reducer or not. The life expectancy is practically the same. So I have a wonderful instrument to show the patient, let's see how it worked. But I'm not interested in my laboratory values, but how long I can live healthily. But maybe we have to go back to blood pressure.
Yes, we should. LDL, I mean L-arginine, OPC. Are there any more important things to say about OPC?
Magnesium.
Exactly.
L-arginine, you said it right, it expands the vessels, really measurable, tangible. And probably arginine is the best natural blood pressure agent I know. But it needs the other so that we can achieve a complete cardiovascular health.
Especially with magnesium. It also has a great effect.
Yes, a relaxing effect on the muscles. And we must not forget that a blood vessel also consists of muscles. The heart anyway. If we have magnesium deficiency, that is the heart pump force or the relaxation in the heart. The systolic blood pressure can then be increased.
Magnesium also has an influence on the acid-base balance, doesn't it? Yes. That's also an important factor. Isn't it also said that acidification can also be a decisive factor for high blood pressure?
When we talk about the causes again, essential means you don't know. But you're right. Acidification certainly plays a role that the heart somehow. It is probably rather the vessel system that causes the high blood pressure than the heart itself. And what we also know is that stress plays a big role. Acidification. I don't know any studies. There probably are. There are now over 30 million studies. I can't read all of them.
But a solution. There is a classic experiment. Like you said, magnesium, L-arginine. And then let's see if the thing is still there.
That's how I do it. I tell the patient to take the blood pressure medication. And I give them arginine and OPC or omega-3. Sometimes 2 things in addition. And then we look again how the pressure develops. Then I have to reach a reduction of 10 to 20 mm Hg with these natural additives, so that I can maybe let go of half a pill. So it really has to be controlled. Because an uncontrolled, high blood pressure really damages the circulatory system.
What do you notice when you have a patient who really takes blood pressure reducers? How does the blood pressure, does it go down systematically? Does it go crazy? What does the patient have to adjust to?
Do you mean medication?
Exactly. He now takes blood pressure reducers, but take L-arginine and magnesium in parallel. There are also things to consider. Where should the patient pay attention to?
You have to try it out. Patients don't always get that. Also, the doctor also has to try it out. Not with every patient the same medication works the same. Some need calcium antagonists. Other AC inhibitors. A third one reacts better to beta blockers. The doctor also has to try it out. If I take a blood pressure reducer, it doesn't go down tomorrow. It takes 2 to 3 weeks for the pressure to slowly go down. And if that wasn't the case after 3 weeks, then I have to change the medication. That's how it works in medicine. And it's the same in nature. I have patients who react to omega-3, others don't. I can't always give the right medication. Medicine is a detective work. You have to feel it. I'll try this. From experience, it's more effective. But I can be wrong and I have to try something else. Sometimes patients don't have the patience. Medicine is not an exact science.
Every body is individual. If I give someone omega-3 and put sunflower oil or rapeseed oil in it, it's obvious that omega-3 can't work in the same quality if the antagonists dominate too much. It depends on that. If I have a patient who doesn't drink anything, how can there be a blood flow? Many are dehydrated.
Yes, dehydration plays a big role in pain. Headaches often have to do with people not drinking enough. Back pain, too. The spinal discs are very sensitive to water deficiency. They hurt a lot more if you don't drink enough. These are side effects. Of course, I can't influence stress that much. But all the life circumstances play a big role. I have another example. A few years ago, I had 200 to 110. I had to take 2 medications in double dosage, so that they even started to work. Today, I still have half a tablet of the low dose besides the vital substances I take. I want to get rid of that, too. I have to increase the arginine dosage to 2 capsules. I hope I can be drug-free soon.
Nice. These are the best examples when you have had the experience yourself.
Yes. One of the most common diagnoses is hypertonia. It's not a joke. I have a high blood pressure. Today, almost everyone has a device at home that can measure, but please not only measures when you get up and before you go to bed, but also during the day. If the measurements are much deeper during the day, the disease is not that serious.
I can imagine that it has to do with the cortisol level in the morning. It's a stress hormone.
But it's not the highest when you wake up. 1.5 hours later it has its effect. And then the blood pressure is lower.
That also contradicts our theory. Yes, okay. Exciting. Finally, are there any to-dos or highlights where you can get information, or if you want to do a holistic checkup?
You can get information everywhere. There is so much information about blood pressure. If you're not sure, you can come to us. Our practice Weiss Medicine in Winterthur. We have a branch in Bruges. It's in Switzerland. For the German viewers it's a bit far. We also have patients from Germany again and again, probably because of broadcasts or videos. Or what I often hear is that you have to look for such doctors. Of course, much more than in Switzerland. But you have to look for them. If you can't find anyone else, you can come to us.
Yes, nice. Thank you, dear Heinz, for being here again. I'm always happy when you come and give us some tips and tricks. Thank you. Dear viewers, the subject of high blood pressure is another one of those topics, but it's all the nicer that there are guests who are always presenting us with new solutions. Hope one or the other hint was in there for you. Thanks for watching and goodbye.